can you put your parents on your health insurance? The blanketed answer is no. Okay. However, there are some circumstances, some situations where you would be able to put them on your insurance. And so in this video, I'm going to go over how you may be able to put your parents on your health insurance. And so you want to stay tuned to the end because there may be some information in there that could help you if this is a situation that you are dealing with. Okay. And so if you are new to me, to my channel, to any of my content in social media land, my name is Katrice, and I am a licensed health and life insurance broker, and I help African Americans to navigate their health care options and enroll into the best coverage based on their budget. Okay. I'm also the founder of Insure Black America, where that mission is to close the insurance coverage gap for African Americans. Okay. And so let's go ahead and jump into it. Can you put your parents on your health insurance? Okay. Now, a lot of times, I've had clients come to me and they're wanting to add their mom because it would be less of a financial burden for their mother or their father, to just add them to their family plan. Okay. Now, depending upon the health insurance company that you have, okay, some insurance companies will let you put your parents on their policy, if they are your legal tax dependent, okay, and if any other specified dependency guidelines are met. Okay. Now, the rules for covering dependent parents may vary depending upon what type of insurance you maintain and where it is purchased. Okay. Now, a little later in the video, I will give just some information that is Googleable. Okay, you can Google this on how you can claim your parents as your legal tax dependent. However, if this is a situation that you are in, then what you may want to do is to go see an attorney about how you can, and have them advise you on the best route. Okay, if that is your situation. Okay. Now, if you are covered through private insurance, okay, your carrier, like I said, your carrier may let you include your adult relatives on your policy if they are your legal tax dependent. Some carriers might require that you require proof that you are the one providing regular financial assistance to your parent, or that one or both of your parents, whoever you're trying to add to the policy, are currently residing with you. Okay, so you may need to show that they get mail at your address. Okay, and so find out if your plan offers the option to cover adult dependents other than your spouse. Okay, so if that's your situation and you are working with a broker or insurance agent, then you are going to want to have them they should know, if you know what I'm saying. If not, you can add adult dependents. If you are doing this alone and would like some help, you can always book a insurance consultation with me and we can discuss this. Okay. Now, if you purchase a plan through the marketplace, the health insurance marketplace, you go through healthcare.gov, then your parents can be, again, considered part of your household if they are your legal tax dependent. Okay. So if your parents are not your legal tax dependent, then you would not be able to add them to your plan. Okay. Now, if you live in a state that has their own healthcare marketplace, then you want to reach out to them. Now, if you have your insurance through your job, then you are going to want to reach out to human resources to see if that can be done. Okay. Now, if you have TRICARE coverage, okay, and if you're in the military and you have TRICARE, then if your parents are your dependents and you are on active duty for 30 days or longer, then they may receive medical care at a military clinic or hospital. And then your parents may also be eligible to enroll into TRICARE Plus, which provide primary care services through certain military clinics or hospitals. And so you're going to want to reach out to your commanding officer, or however you get information about your TRICARE coverage. Okay. Okay. And so let's go over. I'm going to go over now how you can claim your parents as a legal tax dependent. Now, again, I'm not providing legal advice. I am a paralegal, but I am not an attorney, so I am not providing any kind of legal advice. The information that I am providing is Googleable information, okay? Now, if your health plan offers a provision that lets you put them on your insurance, they have to be your dependent, okay? You're going to have to claim them as a dependent, okay? So to declare one or both of your parents as tax dependents, you must meet the following conditions, okay? You can't be the dependent of anybody else, whether they formally claim you or not, okay? Your parents can't file a joint tax return unless they're filing that way specifically to get a refund. Your parent must be a U.S. citizen, resident or national, or a resident of Canada or Mexico. Your parent must have a taxable income of $4,300 or less for the year, and that is very key, okay? And you must have provided more than half of their financial support when considering food stamps, housing, and other government assistance, okay? So if they are living with you, okay, they are living with you, and you are the one paying all the bills. They are not contributing financially, okay? You are taking care of everything for them. They have no income, okay, at all, or their income is $4,300 or less for the year, okay? They can't get more than that for the year. If this is your situation, okay, then you can claim them as your tax dependent, okay? And so, meaning that when you file them on your tax return, okay? So if you can file them on your tax return, then they are your legal tax dependent, okay? And then you can add them to your insurance, okay? All right. So now, if that situation does not apply to you, okay, you may be wondering, well, where can I get some insurance for my parents, or is there a way for them to get like cheaper insurance? And so the first way is Medicare, okay? If they are over 65, well, if they're 65 or over, okay? Or if they have a disability, or if they have been diagnosed with end-stage renal disease, then they may qualify for health insurance through Medicare, okay? So they're going to get their Part A, which covers their inpatient stuff, so that's like hospitals, skilled nursing facilities, home health care, and hospice, okay? Part B covers outpatient stuff, so things like going to the doctor, diagnostic imaging, ambulance, durable medical equipment, so walkers and wheelchairs. And then Part D covers the prescription medications, so any drugs or shots or anything that they need would go through Part D, although some go through Part B. And then Part C, which is what everybody pretty much thinks of when they think of Medicare, which is the Medicare Advantage plans. Okay, and so those are through private insurance companies and are regulated by the federal government. Now, they do offer the same benefits as original Medicare. So Part A and Part B, they must offer the same benefits as original Medicare by law. Okay. And they also offer other benefits that original Medicare doesn't cover, like the dental, the vision, and the hearing coverage. Okay. And Medicare Advantage plans also have that Part D component built into them because they cover prescription drugs. Okay, so you can, if your parents are eligible for Medicare, then you can get Medicare for them. Okay, now if they are not old enough to get Medicare, so if they are in that, like, say 55 to 64 range, okay, and they cannot get Medicare, then you can apply for Medicaid. Okay, and so Medicaid is through your state. Okay, and it provides comprehensive no-cost health insurance to low-income adults and also children. And so because this program is ran jointly by the federal and the state governments, eligibility requirements do vary by your state of residence. Okay. Now, there are income limits to qualify for the program. A lot of states maintain a medically needy program, which means you have to rack up so much a month in medical bills before the state will kick in and cover anything. So, you may get a medically needy amount of, say, $3,400. And so you have to rack up $3,400 worth of medical bills, and then your Medicaid will kick in at that point. Okay, and so you can do that. You can apply for Medicaid for them. Okay, now I don't do anything with Medicaid myself. I do have some information that I give out on how Medicaid works, specifically more for the state of Florida because I'm from Florida. But all of the Medicaid, it pretty much runs the same. The amount of money you can make, the little specific stuff, that type of stuff is state specific. But the overall guidelines for the program are the same. So I can give out information on just the overall guidelines for Medicaid. But a lot of states, I know the state of Florida does, have, where you can call in and you can have somebody and they can walk you through, they can kind of explain to you how to fill out the application or exactly what information they're asking for on the application. Okay. The health insurance marketplace, which is it is where you go to get it's the ACA. Okay. And so it offers medical insurance to U.S. citizens or nationals who reside in the United States and do not have Medicare coverage. Okay. If you're eligible for Medicare, then you cannot get insurance on the health insurance marketplace through using a subsidy. Okay, that's a caveat. If you have Medicare, if you're eligible for Medicare and then you don't want to get Medicaid, then you don't want to use the Medicare, you want to stay on the marketplace, you can do so, but you will have to pay the full cost. You won't get like the subsidy to help you with the cost of it. But that's a whole nother video that I'll make a video. I'm going to write that down. Medicaid, hold on. Can you get place instead care. Okay, I had to write that down because that's a good topic. And I didn't want to forget that. Okay, so you can go through the marketplace, and you can. Now it is based on your income. So if they don't have any income, then obviously they won't be able to get insurance here because you do have to meet a certain amount of earned income per year. And then if you want to get your parents a private health insurance plan, you can do so. However, private health insurance plans are underwritten, so if your parents' health isn't the best, this wouldn't be an option. It wouldn't be a good option for you. Okay, well, for your parent, because especially if they take medications, and depending upon the medication, even if they got approved to be on the plan, there's like a blackout period with a lot of private health insurance plans, and they won't pay for any coverage, for any treatment for a prior existing condition for a certain time frame of being enrolled in the plan. So anything new it would pay for, but not anything pre-existing. Okay. Now, if you need more information, if you're unable to find suitable insurance, guidance is available through resource sources such as your local area agency on aging. Okay, these agencies offer free over the phone or in-person counseling, and so you can go and you can call them and speak with them and see if there's something that they can recommend to you to help you out. Okay. All right, and so I hope this video was valuable. If it was, please do share it out with someone who, they are taking care of their parents and they may need some guidance on how to get their parents health insurance. Share this information with them. Okay. Now, if you are looking for health insurance for yourself, if you're looking for health insurance for your parents, you can schedule a free insurance consultation with me where I go over your health needs and we break down and see exactly what it is that you are needing when it comes to your health needs. And then we look into plans that will cover those health needs, that will cover the most, give you the most coverage for the best affordable price. Okay, and so you can go to my link tree. It'll be in the description of this video. It'll also be on the home page. You can go there, you can book your consultation. It is free, no charge, and we'll just go over everything, and then we'll put a plan together for you based upon your budget. Okay. All right, and so until the next video, I hope you guys have an amazing rest of your day, and remember that together we can close the insurance coverage gap for African Americans. Have a good one.